Hello friends, one of the very good question is what are the risk factors of psoriasis? We can translate it, what are the complications of psoriasis or what is the future of psoriasis? Because psoriasis is a skin disease. It is an autoimmune disorder which is exhibited on the skin. That is, you have excessive production of a skin and the skin comes out in the form of dandruff or dead skin from the body. And since it is a lifelong disease, people are suffering from 5, 10 or more years. They are having psoriasis and they don't have any other problem. So they think that it is just a skin disease. You get itching and you just have the dead skin and you can clean it up. It's fine. So rather they become fearless, or they become what we can say that careless about their psoriasis, and they just live the life like that. But psoriasis is not an innocent disease. It can remain in a mild form for pretty long years. The risk of psoriasis: number one, psoriasis does not affect only the skin. Almost in 50% of the patient, it can go to the severe type of arthritis called as psoriatic arthritis, which can fuse your joints and you may not be use it permanently. So there is a fuse and bending of your joints and you cannot use it. All the joints can be curved permanently. This is one of the danger. Another thing is that if one is having a psoriasis, and since it is an autoimmune disorder, there are other lifestyle or other disorders like heart diseases, diabetes, cancer. All these diseases are there, and it has been found that psoriasis patients have the tendency of getting these diseases almost double than the normal person. A normal person having a tendency for diabetes, heart diseases and cancer, there is certain percentage. But if one has a psoriasis, because of psoriasis, the percentage is almost double. So psoriasis patient must be aware of this risk of having diabetes, having cancer, having heart diseases, because all these diseases we mentioned, they are chronic inflammatory diseases, and psoriasis itself is one chronic inflammatory disease. And when all these people, these diseases, all these other diseases, heart diseases, diabetes, they come together with psoriasis, they can form a cluster that is called as a cluster disease, and all these diseases can cause a third important disease, and which can cause the life to the patient. So definitely the cluster should not form. Let us discuss what are the risk factors of psoriasis. Number one, we find that psoriasis is a disease that is visible, and people definitely, when it is on the face or other parts of the body, they go in depression. They get self-consciousness and they won't like to go out or mix in the people. They remain alone. And when they remain alone, they get more stress. So this causes a depression and loneliness in the psoriasis patient. Another important thing, as I told you, that psoriasis, the main trigger factor of the psoriasis is the stress and depression. So all those people who have tendency to psoriasis and they have depression, they can get psoriasis afterwards. And psoriasis itself is a cause of depression. So it is a vicious cycle that because of depression or stress they got psoriasis, and psoriasis created a stress and again it aggravated a stress. So this is a vicious circle one must know. Another important thing, that when one gets psoriasis, he usually becomes depressed, does not mix in the people, and the exercise, going in the people doing exercise or controlling the diet, or because of depression, overeating, the obesity comes up, and because of obesity also psoriasis aggravates. Another important thing we notice in psoriasis patients, when one gets depressed, he is addicted to drugs like alcohol and smoking. So when they go and take alcohol and smoking, they may be getting temporary relief from these drugs for their depression. But these drugs themselves are the trigger factors of psoriasis. If one does not have a depression, if one is addicted to smoking and alcohol and he has also have a tendency of psoriasis, he will get psoriasis because of addiction to these drugs. So lack of exercise, obesity, alcohol, smoking, all these are the trigger factors. And nowadays we find another important, the fast foods, the lifestyle, and taking fast foods frequently or in more quantity, like the aerated drinks. All these things are not nutritious. They are the cause of obesity because they contain very high sugar, high salt in them. So all these things also cause high blood pressure, heart diseases, and they are eventually also the trigger factors of psoriasis. So these are all the risk factors of the patient who have already psoriasis. Thank you.